Here.
Senator Felag.
Present.
Senator Cano.
Present.
Senator Murray.
Present.
Senator Seveny.
Here.
Senator Sosnowski.
Here.
And Senator Acosta.
Here.
8 members. There is a quorum.
Thank you so much, Mr. Clerk. We're going to begin our hearing today on several Senate bills that are for hearing before proceeding to the budget hearing.
Mr. Chairman, we have a lot of echo.
We're going to work to fix that right now. We'll try that again and see if the echo continues. The first bill up for hearing today is going to be Senate Bill 101 by Senator Calkin, an act relating to human services, health care for families. I know that Senator Calkin is currently having some health care issues, and she has asked Senator Bell to appear today to introduce this bill on her behalf. And with that, Senator Bell, I want to ask you to introduce this bill on behalf of Senator Calkin.
Thank you so much, Mr. Chairman and members of the committee. I wish I were here under better circumstances. This legislation by Senator Calkin originates in the state of Massachusetts. Essentially, the problem is that many employers, particularly large employers, pay such low wages that their employees actually qualify for Medicaid. And Massachusetts implemented a policy where an assessment was levied on employers who pay such low wages that their employees actually qualify for Medicaid. This serves a couple of really important purposes. One, of course, is to defray some of the costs to the state, so we're not subsidizing low wages. But another crucial element is that it provides a valuable incentive to raise wages and encourages fairer wages across the board. It also has the benefit of providing additional revenue to the state, which is something that is always useful. Governor Raimondo introduced this as a budget proposal a few years ago, although it was ultimately not enacted. And so what this legislation does is implement the proposal proposed by Governor Raimondo a few years ago. The main difference from the Massachusetts plan is that it is limited only to large employers of 300 employees or more. I think it's an excellent policy that balances a number of crucial public policy goals and would be very beneficial for our state. And I think it's something that we should move forwards with in this budget cycle. With that, I'd be more than happy to take any questions.
Thank you so much, Senator Bell. Are there any questions for Senator Bell from members of the committee? Hearing none. Thank you so much, Senator. We do have 2 witnesses signed up to testify on Senate Bill 101. The first is Michael Bigny with Home Health and Hospice Care of Nursing Placement in opposition. Okay, we've attempted to call two individuals, but they were not available to testify at this time, so I will just read who they are and their positions. Michael Bigny with the Home Health and Hospice Care of Nursing Placement was in opposition to the legislation, and Season James representing themselves in support of the legislation. With that, that does conclude our testimony on Senate Bill 101.
Motion to hold?
Senator Palmer makes a motion to hold. Second by Senator Seveny. Would the clerk please call the roll?
Chairman Pearson,
Yes.
Senator DePalma,
Yes.
Senator Felag,
Yes.
Senator Acosta,
Yes.
Senator Cano, Senator Cano, Senator Murray,
Yes.
Senator Chacon, Senator Chacon,
Yes.
Senator Seveny,
Yes.
Senator Sosnowski.
Yes.
8 in favor, 0 opposed.
Thank you so much, Mr. Clerk. Next on our agenda is going to be Senate Bill 576 by Senator Cano, an act relating to state affairs and government, health care for children and pregnant women. Senator Cano.
Thank you, Mr. Chairman, members of the committee. This bill is a really important bill, and I wanted to just give a little context of the bill. In 1996, Rhode Island used to use the state-only funds to provide health insurance coverage for low-income, non-citizen children, including undocumented children who met income guidance. Between 2006 and 2008, the General Assembly repealed coverage for children not eligible for federal funding. And by June 2008, over 2,800 legal permanent resident children who had lived in the United States for less than 5 years and undocumented children who were previously enrolled in the Rite Care lost coverage. And it was really, really devastating for the community. In 2009, the federal matching funds for lawful resident children became available to states as a result of the reauthorization of the Children's Health Insurance Program. And as of April 1, 2010, lawfully residing immigrant children, including LPR children, refugees and asylees were always eligible for Rite Care, and several other status became eligible for the Rite Care. I think that it's important to go with the history of this bill, because what we're trying to do here with this legislation is to make sure that we cover all children that currently goes to our schools, and we don't ask for a status when we provide public education. But right now we are leaving them out of having access to health care and insurance. And that is like really, for me, heartbreaking. And it is something that in a pandemic, we have seen how important it is to have health care. It is important that we do some things. And the things that I like to achieve with this, or the goal of this bill, the covering all kids, is that we must restore access to Rite Care for low income eligible children who are undocumented immigrants. All children need access to health care that supports their healthy growth and development and promotes school success. Health insurance coverage increases the likelihood that children will receive needed preventive services and reduces emergency room costs. I want to also mention that there is some impact to this legislation. In 2019, 98.1% of Rhode Island children had health insurance coverage. Only about 5,000 Rhode Island children are uninsured, and 3,000 of these children are income eligible for Rite Care. It is important for us to understand that out of those $3,000 that are uninsured in income eligible children, not all of them are undocumented. And it costs approximately $199 per month, or $2,388 per year, for the state to cover a child on Rite Care. Under the assumption that all of these 3,000 uninsured income eligible children are undocumented, It is estimated that the most this bill will cost the state is approximately $7.2 million. The actual dollar amount this bill will cost the state is likely to be lower, given that it is unlikely that all 3,000 uninsured income eligible children are undocumented, like I said before. So at the end of the day, I just want to make sure that you all know that this is a very important bill that we need to prioritize, and that is also very important to know that there is a bunch of organizations that are supporting this legislation and make it a priority, as well as the Black and Latino Caucus that has received like a lot of support for this legislation. It is very important that we cover all children and that we make it a priority, as I said. And I really appreciate you taking the time for listening to my testimony. And I want to take the time right now to say thank you to the people that are going to come and testify in this bill in support. And we just need to act now. So thank you so much.
Thank you so much, Senator Cano. Are there any questions or comments from members of the committee? Okay. Hearing none, we do have several individuals signed up to testify, all in support of this legislation. The first is David Veliz, representing the Rhode Island Interfaith Coalition to Reduce Poverty, in support of the legislation. David, welcome to Senate Finance.
Thank you very much to Chairperson and committee members, and thank you for having me. My name is David Veliz. I am the director and lead organizer for the Interfaith Coalition to Reduce Poverty. I'm also here with the Rhode Island Poor People's Campaign, and we are here to show our support for Bill 576. And thank you to Senator Cano for introducing it. We believe that healthcare is a human right, and that all people, regardless of immigration or socioeconomic status, deserve health care. This legislation would provide thousands of children with access to health care, and who among us can say that children shouldn't have health care? Our hope is that this pandemic has highlighted the disparities in healthcare that impact our communities and have pushed us to do better. And one of those areas that we can do better is by providing all children with healthcare. For us, this is about fighting poverty, like we do in our organization. But it's also about justice, and it's also about doing what's right. Through our different faith perspectives that we as a coalition of faith leaders and advocates represent, we have countless examples of how we should be supporting our immigrant communities and taking care of we call travelers. And I'll just read one of them. It says, "The stranger who resides with you shall be to you as one of your citizens. You shall love them as yourself." Lastly, I will say that as someone like myself who grew up undocumented, I can personally attest to the strain that puts on a family who is just trying to get the kids in their family vaccinated, preemptive care, and all the things that children should be, that children need to be safe. So I implore you to pass this bill. I thank you for your time. I thank you for supporting children in Rhode Island, and you have a good night.
Thank you so much, David. We appreciate your testimony. Any questions or comments from members of the committee? Hearing none. Thank you so much.
Thank you.
Next testify is going to be Linda Katz, representing the Economic Progress Institute, also in support. Linda, welcome back to Senate Finance.
Thank you, Chairman Pearson. Good evening, members of the committee. This is Linda Katz, the Policy Director at the Economic Progress Institute. I first want to thank Senator Cano for her leadership in promoting access to health care for Rhode Islanders, as well as equity for immigrants through this bill and through her other legislative priorities. She gave a great description of how Rhode Island back in 1996, when the federal government decided to make even legally present immigrants ineligible for a range of public benefits, Rhode Island said, no, we're going to use our state dollars to make sure that we're doing the right thing and providing health insurance coverage for children. And then the next year decided that we would cover undocumented kids as well. So Rhode Island, back in the late 1990s, made a commitment to cover all kids. Budget constraints then led to a change in that coverage, and it is absolutely correct that we should go back to where we began, which is Rhode Island should have a commitment to ensure that all of our children have access to health care by enrolling them in our high-quality and cost-effective Rite Care program. I'll note that California, Illinois, Massachusetts, New York, Oregon, Washington, and the District of Columbia use state funds to cover all kids, and actually 2 years ago, California decided to extend coverage up for young people up to the age of 25, regardless of status. I think, as David has said, this past year has certainly demonstrated vividly how we are all connected and how what happens to one in our community impacts us all. So while it is the fiscally prudent thing to do, since we avoid more costly Medicaid costs if a child winds up in the emergency room of the hospital where we're required to use Medicaid dollars to cover those children, which implicates state funds as well. The real issue is we should cover all kids because we are all one family, and it's the right thing to do. Thank you.
Thank you so much, Linda, for your testimony. We do appreciate it. Are there any questions or comments from members of the committee? Hearing none. Thank you so much, Linda, for your testimony.
Thank you.
Next testify is going to be Hannah Stern, representing the ACLU of Rhode Island in support. Hannah, welcome to Senate Finance.
Thank you, Chairman and members of the committee, for your time this afternoon. My name is Hannah Stern. I'm testifying on behalf of the ACLU of Rhode Island in strong support of this legislation. Though this has always been the case, it's really undeniable that the last year has only cemented the importance of accessible and comprehensive health care for all residents in Rhode Island. We just think that this legislation would importantly ensure that equity and accessibility to this process for all families, regardless of immigration status. And it would also importantly ensure that no one forgoes accessing health care out of fear that their immigration status may be exposed. So we strongly support this legislation and we urge passage. Thank you for your time. I'm happy to take any questions.
Thank you so much, Hannah. Are there any questions or comments from members of the committee? Hearing none. Thank you so much.
Thank you.
Next testify is going to be Representative David Morales, representing District 7 from the House of Representatives. Representative, welcome to Senate Finance.
Thank you so much, Mr. Chairman and members of the committee. I want to thank you all again for the opportunity to testify in support of Senate Bill 576. Today, I'm proudly speaking on behalf of our state legislature's Black and Latino Caucus. Now, among many of the effects we have seen COVID have on our communities, we saw how fragile our healthcare system is and how important it is that all our residents, especially our most vulnerable, have dependable healthcare coverage. For instance, just last May, over 20,000 Rhode Islanders lost their jobs and were thrown off their health insurance. Thankfully, we've started to make progress to recover from this deadly pandemic, and these working people, along with their families, have been able to regain their healthcare coverage once again. Unfortunately, however, there is a population of people in our state, low-income children to be exact, whom for years, pre-pandemic and since the pandemic, have been forced to live without healthcare coverage. As mentioned by Senator Cano, between 1996 and 2008, Rhode Island was one of the only states in the country to guarantee healthcare coverage to all children 19 and under, regardless of socioeconomic or immigration status, through the Rite Track program, our state's Medicaid program for children. In 2008, however, the administration at the time cut the provision of this program from the state budget, and it has not been restored since. As a result, we have over 3,000 children, about 2% of children in our state today, who lack health care coverage through no fault of their own. And unsurprisingly, of these 3,000 children, a disproportionate number of them are children of color and or immigrants. Through Senate Bill 576, however, we can restore this coverage to the provision of state funds and the max utilization of federal funds. So now more than ever, it is important that we reinvest in the health of our children. It is not only our moral obligation, but because the consequences for this lack of coverage is costly to our state, both economically and in terms of our public health. To illustrate, children who have health care coverage, whether it is through their family's private insurance plan or Medicaid, are healthier and have significantly fewer preventable hospitalizations than children who are uninsured. given that they're more likely to receive primary and preventative medical and dental care, have access to specialist physicians, and have fewer unmet health needs than uninsured children. Meanwhile, uninsured children are much less likely to receive basic and medical and dental care, which often leads to poorer childhood health, higher childhood mortality rates, and less participation in extracurricular activities, along with worse academic performance. And this is not surprising given that the issue of healthcare accessibility is intersectional with education, mental health, and the ability to achieve socioeconomic mobility. And furthermore, we just need to recognize a lack of healthcare coverage for one population of our children hurts all of our children and families. Given that here in the United States, all children are entitled to a public education regardless of their background, whether it's economic status, race, or documentation status, we have children in our public schools that lack health care, thus being more likely to be sick or have undiagnosed conditions, which in turn can affect the health of their peers who are insured. In other words, uninsured children can put other children at risk through the spread of a disease or infection given their lack of preventative care in the first place. With all that said, I truly hope this is a piece of legislation both our chambers in the House and the Senate can prioritize and push forward, because all our children, regardless of their background, deserve the basic investments of healthcare. Thank you.
Thank you so much, Representative. Are there any questions or comments from members of the committee? Senator Cano.
Thank you, Mr. Chair. I just wanted to say thank you to Representative Morales for his leadership when it comes to this bill. He didn't mention that he's the sponsor in the House, and he has been a great partner, along with the organizations that are really supporting this bill to make sure that all of our children are covered with health insurance. I just want to say thank you so much for your leadership, your advocacy, and for being a great partner to make sure that this legislation is prioritized both in the Senate and in the House. So we really appreciate it.
Thank you as well, Chairwoman Cano, and I look forward to getting this to the finish line.
Thank you so much, Senator and Representative. Are there any other questions or comments from members of the committee? Hearing none. Representative, thank you so much for joining us this afternoon.
Yep, take care.
Thank you. Next to testify is going to be Shamus Dorak, representing the Rhode Island Parent Information Network in support. Shamus, welcome to Senate Finance.
Hi. Thank you, Chairman, members of the committee, and to Senator Cano for introducing this bill to improve access to health care for Rhode Island's children. My name is Shamus. I'm testifying today on behalf of RIPEN, the Rhode Island Parent Information Network. Rhode Island has done very well to reduce the rate of uninsurance among Rhode Island's children. As of 2018, only 2.2% of Rhode Island children under age 18 were uninsured, well under the national average of 5.2%, third best in the country. However, many of that remaining 2.2% who need to be covered to ensure that all of Rhode Island's children have access to health insurance coverage and to meaningful health care are children without documented legal status. Many others are children with legal status, but who are part of mixed status families who may not understand that their children are, in fact, eligible for Medicaid. This includes many children with serious health care needs like cancer, developmental disabilities, severe behavioral health conditions, the list goes on, whose families are unable to afford to pay for their kids' medical expenses, and whose serious health care conditions go untreated, resulting in far worse health care outcomes. This legislation will help bring these kids into the health insurance system to satisfy the state's commitment to cover all of Rhode Island's kids, help improve health care outcomes, and reduce the use of expensive, unnecessary emergency care services that the state and its taxpayers end up paying for anyway. As others have testified, this is something Rhode Island has done in the past, something that many of our sister states do to protect the health of their children, and it's the right thing to do. So we urge the Senate Finance Committee to move forward with this legislation. Thanks very much.
Thank you so much, Shamus. Are there any questions or comments from members of the committee? Hearing none, thank you so much. Next to testify is Andrew Poya, representing himself, also in support. Andrew, welcome to Senate Finance.
Hi, Chairman Pearson. My name is Andrew Poya. I'm a resident of Providence, and I'm calling in support of Bill 576. I think it's a great step in the right direction to provide health care for all children and pregnant women in Rhode Island. I think, I would like to see Medicare for all. The bill that was proposed this year for Medicare for all, but this is a step in the right direction. I'm a union worker and a father, and a lot of people think that, union workers have really great health care, and even with that, we end up spending a lot of money, both on the premiums and then co-pays and deductibles. We always end up hitting our maximum deductible. I have 3 young kids. Someone always ends up getting sick, and we always end up spending a lot of money out of pocket. And so I support this bill. I didn't sign up for it, but I also support the doula funding of Article 12, Section 8. So I just wanted to voice support for both of those. Thank you.
Thank you so much, Andrew, for your testimony. Are there any questions or comments from members of the committee? Hearing none. Andrew, thank you so much.
Thank you.
Next to testify is going to be Cecile Kizerziegler, representing Dorcas International Institute of Rhode Island, also in support. Cecile, welcome to Senate Finance.
Thank you, and good afternoon. My name is Cecile Kizerziegler, and I'm a staff attorney at Dorcas International Institute of Rhode Island, where I manage the Immigrant Victims' Rights Project. I'm here today in support of the Senate Bill 576 that would ensure that all children who are residents of Rhode Island and income eligible qualify for health insurance, regardless of their immigration status. In the Citizenship and Immigration Services program at Dorcas International, we serve over 3,500 immigrants and refugees each year by providing consultations and representation on humanitarian and family-based applications. This bill impacts our clients and their children, some of whom are documented, some of whom are undocumented, and many of whom are somewhere in between. Taking our children to the doctor for a checkup or to the hospital when they are sick is something most of us take for granted. Healthcare for children is an investment, not a cost, and it benefits our entire Rhode Island community. To deny this right to otherwise eligible Rhode Island kids who've met the residency and income requirements is dehumanizing. Linking health insurance to proof of immigration status is an unnecessary and punitive measure that causes harm to children and causes stress and anxiety for our clients who may be forced to choose between taking a child to the doctor or paying for rent or putting food on the table. I want to highlight the story of one of my clients who courageously wrote down her very personal story for submission today. Her name is Deborah, and she is a student at Classical High School. She is a brave and amazing young woman, and I urge you to read her words. Due to circumstances beyond her control, Deborah and her mom and sister were suddenly left homeless and undocumented. They lived in Rhode Island for 2 years without medical insurance or access to health care. During this time, Deborah explains, she started having persistent and excessive pain and bleeding seemingly connected to her monthly cycle, but it wouldn't stop. Her family did not have money to pay for doctor's bills, and seeking help when you're undocumented can be too overwhelming when you don't know your rights. In Deborah's own words, and I quote, "I missed a lot of school because of the pain, and it was scary because I didn't know what was wrong with my body," unquote. After Dorcas International filed immigration paperwork for Deborah and her family, and she became eligible for health insurance, she was finally able to go see a doctor without fear. Deborah explains that the doctor ran tests, diagnosed the issue, and prescribed medicine that easily treats and manages her condition. The pain has stopped, and she no longer misses school. Please read her story. Deborah is just one of many kids in our state, and we can and should do better. No child should have to wait or be denied access to health care when they are sick or suffering, and all parents should feel safe taking their children to the doctor or hospital. We urge you to enact this law in Rhode Island. Thank you.
Thank you so much, Cecile, for your testimony. Are there any questions or comments from members of the committee? Hearing none, thank you so much. Next to testify will be Ashley Gomez, representing herself, and also Testify RI in support. Ashley, welcome to Senate Finance.
Hi, thank you very much, committee members, for your time, and thank you, Senator Cano, for sponsoring this bill. My name is Ashley Gomez. I live in Providence, and I'm a health policy research scholar with the Robert Wood Johnson Foundation, a doctoral candidate in public health at Brown, and I'm a member of Testify, a grassroots organization here in Rhode Island. I'm representing Testify and myself in support of Senate Bill number 576. National studies show that perceptions of restrictive immigrant policies in a state, such as the lack of health care for undocumented children, are associated with higher mortality, poorer self-reported health, and poorer mental health among Latinx adults and children, regardless of status, but especially among those in mixed status families. This bill would not only improve the health of the children it extends health care to, it has the potential to contribute to improvements in mental health among Black, Latinx, and Asian immigrant communities here in Rhode Island by showing us that our children are no less deserving of health care than any other child. Just as Rhode Island did previously, other states implemented similar policies long ago, and we have research evidence about the effects. In a study by Howell et al., the impact of new health insurance coverage on undocumented and other low-income children, lessons from 3 California counties. Results of this consistently showed that health insurance enrollment increased access to and use of medical and dental care, reduced unmet need for those services. After only 1 year, programs improved the health status of children, including reducing the percentage of children who miss school due to health. In my own research, I interview immigrant Latinas about their health and that of their families. One story sticks out in particular, where a mother noted the immense distress she felt living in a state where she had nowhere to take her child if they were to get sick. The public health research shows us that lack of health insurance puts families at higher risk for poverty and food insecurity. Additional benefits of this bill include keeping kids out of the emergency room and keeping kids in school, thus reducing absenteeism, which is good for all of us. With this bill, we ensure that the children who grow up here grow up to become loyal Americans. They are children, and they are no less deserving of health care than any other child, and they are as American as any child born here. I urge you to vote in favor of Senate Bill 576. Thank you for your time.
Thank you so much, Ashley, for your testimony. Are there any questions or comments from members of the committee? Hearing none, thank you so much, Ashley. Next testify is going to be Caitlin Arona, representing Rhode Island's Kids Count, also in support. Caitlin, welcome to Senate Finance.
Hi, Mr. Chairman and members of the committee. Thank you for the opportunity to provide testimony tonight. My name is Katie Arona, and I'm here on behalf of Rhode Island Kids Count in order to voice our strong support for Senate Bill 576, which, as you know, would reestablish Rhode Island's commitment to provide health insurance to low-income children who are residents of the state, regardless of immigration status. And on behalf of our organization, I would really like to thank Senator Cano for her leadership in sponsoring this bill. Our support for this legislation reiterates our organization's strong commitment to addressing the needs of children and families in the state, with a particular focus on addressing racial and ethnic disparities. As you've heard from various testimonies tonight, Rhode Island once covered all low-income children, regardless of immigration status, for almost 10 years in the late 1990s and early 2000s, and many other states have already chosen to do this in the meantime. And it is time that we reestablish this commitment to do so. Representative Morales touched on this a bit when he talked about the importance of health insurance coverage for children. Children who have health insurance coverage are healthier and also have fewer preventable hospitalizations than those who are uninsured. What's great is that evidence also shows that Medicaid, or in our state, Rite Care, has worked to reduce racial and ethnic disparities in access and utilization in healthcare, as well as improved educational outcomes and shielded children from poverty. According to our latest numbers in 2019, 98.1% of kids in our state had health insurance coverage. And as Senator Cano mentioned, only about 5,000 Rhode Island children are currently uninsured. And we know about 3,000 of those kids are low income and therefore are income eligible for Rite Care. And some percentage of those children are undocumented and would be impacted by this bill. So to achieve our goal of covering all kids, We must restore access to Rite Care health insurance coverage for income-eligible kids who are undocumented immigrants. We firmly believe all children need access to health care that supports their healthy growth and development and promotes school success. More importantly, it is far more cost-effective to provide access to primary preventative care to undocumented children through the Cover All Kids bill before you today than it is for paying the far higher cost when a health condition that could have been prevented or treated early escalates to an emergency situation that requires an emergency room care that the state pays for. Rhode Island Kids Count thanks the General Assembly for their dedication to improving children's health in the state of Rhode Island and urges you to pass this bill. Thank you.
Thank you so much, Caitlin, for your testimony. We do appreciate it. Are there any questions or comments from members of the committee? Okay, hearing none. Thank you so much, Caitlin, for your testimony today.
Thanks.
That does conclude our testimony on Senate Bill 576. With that, Senator
Motion to
Palmer.
hold.
Senator Palmer makes a motion to hold. Second by Senator Sosnowski. Will the clerk please call the roll?
Chairman Pearson.
Yes.
Senator DePalma.
Yes.
Senator Felag.
Yes.
Senator Acosta.
Yes.
Senator Cano.
Yes.
Senator Chacon. Senator Chacon, yes. Senator Murray.
Yes.
Senator Seveny.
Yes.
Senator Sosnowski.
Yes.
9 in favor, 0 opposed.
Thank you so much, Mr. Clerk.
Sorry, Mr. President wants to vote.
Mr. President is also recorded in the affirmative.
10 in favor.
Thank you, Mr. Clerk. That does conclude the actions on Senate Bill 576. Next on our agenda is going to be Senate Bill 706 by President Ruggiero, an act relating to taxation and property subject to taxation exemptions. Mr. President, thank you for joining us today in Senate Finance.
Thank you very much, Mr. Chairman and members of the committee, and I will be brief. The legislation before us is very straightforward, and it would provide property tax exemptions for property owned by LaSalle Academy. It was requested by the Academy. It is a routine for the General Assembly to grant such an exception to nonprofits of all sizes, both large and small. As with many nonprofits, the community benefits provided by LaSalle Academy are very significant. They're a great neighbor in the community. They provide not only education, but also tremendous cultural value. Furthermore, with hundreds of students enrolled in the Academy, they are lessening the property tax burden on Providence and other communities who otherwise would be responsible for providing it. Mr. Chairman, I'm happy to take any questions, but as I noted, this legislation is similar to what we enact on a regular basis to provide a tax exemption to nonprofit institutions.
Thank you so much, Mr. President. Are there any questions or comments from members of the committee for President Ruggiero?
Yeah. Chairman.
Senator Chacon.
Pearson. Thank you. Senate President, I don't have a concern about the giving a tax credit, but I think by giving the tax credit with Providence and the financial situation it's in, it's going to create more of a burden. The other problem I have is most of these institutions, when they started with a footprint of the original building. Over the course of the years, based on their tuition increases and the amount of enrollment, they went out and they bought more land, more buildings. And personally, I believe the original buildings, similar to like Brown, and I'm against Brown with that St. James Charter, should be the original building, and everything else should be taxed to alleviate some of the tax problems for some of the residents in Providence. I mean, I'm in favor of giving the original building tax exemption, but all the other property, I can't see that right now.
It's my understanding that LaSalle has not acquired any property that they did not have before. I know there's a movement to acquire the Providence Water Supply Board, but I don't think that has happened at this point in time. So I feel that they should be treated in an equitable manner like every other nonprofit is treated in the state that we've dealt with regarding issues of this nature. I think it's a question of fairness.
Thank you, Mr. President. And I do want to note for members of the committee, we do have a fiscal note on this. The estimated impact is about $98,000 versus the city's levy of about $358 million for a 0.027% impact to their levy, on this piece of legislation. Are there any other questions or comments for President Ruggiero from members of the committee? Senator Acosta.
Thank you, Mr. Chairman, and thank you, Mr. President, for this legislation, for the opportunity to ask some questions. I have two questions. The first one is really simple and is wondering whether the city of Providence has expressed its either support or opposition to this legislation. As my colleague alluded to, this is ultimately about something that impacts that city, and so I was interested, and I was trying to get through the materials, but I didn't see if the city was on record. And the second, a little bit more broad, but is about the amount of money that we subsidize, not just this school, but other private schools with in terms of busing and textbooks. And so it's my understanding that this school charges a pretty high tuition, something around the ballpark of $16,000 a year per kid, has about 1,500 students. We're talking about a budget of approximately $24 to $25 million a year just from tuition. That's not counting in other contributions. And the tax from the fiscal note we got is pennies on that amount of money. It's somewhere between $96,000 and $100,000. And so I guess what I'm really trying to get at is, is that cost more or less than what we as a state are already giving them to provide transportation for their students? And is this a conversation that this institution and that we as a legislative body are willing to reopen? Because I do think kind of conflicts with the separation of church and state for us to be operating like that right now.
Thank you, Senator Acosta. And just two things for the benefit of the committee, Mr. President, if you don't mind, before. We do have communication from a member of the Providence City Council, Councilman Ryan, in support of the legislation. And I did speak with the city earlier as well. And then to your second question, Senator Acosta, related to the specifics of transportation cost, I certainly don't know off the top of my hand, but I do know we have individuals that are signed up to testify from LaSalle and others that may know some of those questions. But Mr. President, I turn it over to you.
Yes, I want to thank Senator Acosta for the question, and I also want to mention that the reason why the tuition is as high as it is at LaSalle is that there are many students that go there that don't pay the full tuition, and they kind of subsidize, and many of those are minority students that attend LaSalle, and that's why the tuition is what it is. And that's why they're looking for a little break on their taxes. I don't think $98,000 that the city might lose is going to put the city into bankruptcy. So that's what I think in that particular situation. But they do provide subsidies for a lot of young people who definitely could not afford the tuition at LaSalle.
Thank you so much, Mr. President. Senator Felag.
These type of institutions are eligible for the pilot program?
Senator, we don't believe that this would be eligible under pilot at this time.
Okay.
Are there any other questions or comments from members of the committee? Okay. Hearing none, Mr. President, thank you so much for joining us here in committee today. We do have several individuals signed up to testify. Senator Bell is first and is asked to testify on this legislation. I know he is joining us today via WebEx. Senator Bell, please proceed.
Thank you so much, Mr. Chairman and members of the committee. This legislation, there's some history here. As I think all members of the committee know, the city of Providence has faced considerable financial challenges for some time and currently faces a considerable tax burden. In addition to these financial challenges, a core part of Providence's challenges has been that a very large percentage of the city's real estate is owned by nonprofits. Many of these nonprofits do have substantial funds available at their disposal. And for many years, the city of Providence had simply not collected on the taxes owed to private high schools. This was discovered that this was not legal, and the city of Providence started collecting on the taxes owed by private high schools. Under the state law, there's a formula that determines how much land can be exempted by private schools. You can exempt 1 acre for having a school. In the case of LaSalle Academy, it is actually able to exempt 11 acres because there's a chapel on the site and a priest's home. So under the current formula, LaSalle is treated considerably more favorably than other private schools in the city of Providence. When this legislation was proposed last year by then Representative McKiernan, I held a community meeting on this because LaSalle is in my district. And I knocked on doors in the area around LaSalle, spoke with residents. And at my community meeting and my conversations with constituents, there was overwhelming opposition. People in Providence have been deeply upset by the pattern of special deals for individual nonprofits that do have the funding to pay very small tax burdens, and the idea that individual nonprofits deserve a special deal so they don't have to pay any contribution to the city. So because of the strong opposition, I came out in opposition to this legislation. It did not move last year. And I think that there are some additional specific concerns in this case. One of my concerns is that were we to do this, I believe we would create a spiraling effect, where then the other private schools across the city would then come for their exemptions. I think that it is problematic to do one-off deals. And in the past, we have done these deals primarily where the municipality wants it, the local senator wants it, and the local representative wants it. In this case, while I believe one member of the council supports this, there is no council resolution. There is, I as the local senator oppose this, and the local representative also opposes this. In those cases, typically we have not moved forward with such legislation. I also believe it is of special importance that given the condition of the current Providence public schools, while the Providence public schools are under such incredible stress, I am bothered by a trend to provide this benefit towards a private school while the Providence public schools are undergoing such difficult times. And I believe that we should prioritize our public schools over private schools. And so with that, I'd be more than happy to take any questions about the specifics of this legislation and why it is very important to the community I represent that this legislation not move forwards.
Thank you so much, Senator Bell. Are there any questions or comments for Senator Bell? Okay. Hearing none, Senator, thank you so much for joining us today and for your testimony.
Thank you so much.
Next to testify is going to be Representative David Morales. Representative, welcome back to Senate Finance.
Thank you so much, Chairman. Now, Mr. Chairman and members of the committee, thank you again for the opportunity to testify in firm opposition to Senate Bill 706. For context, I am the state representative for House District 7, where LaSalle Academy is located. Now, in summary, this bill would provide LaSalle Academy, a wealthy private school in the Mount Pleasant neighborhood, tax exemption status. This bill would also exempt any land that LaSalle Academy purchases in the future from taxation. Founded in 1871, LaSalle Academy has a student population of nearly 1,600 students, of which only 180 are actually Providence residents, along with an annual tuition of over $15,000. According to their last fiscal year report, all of their reported endowments combined are worth over $13 million, and these are just for the ones whose values were disclosed, as there were over 40 endowments whose amounts were not revealed in the report. In addition, LaSalle also receives millions of dollars in contributions from alumni and corporate partners annually. This is separate from their endowment gifts. Clearly, LaSalle Academy has more than enough revenue and assets to pay their fair share of property taxes, just like every other property owner in the Mount Pleasant and Elmhurst neighborhood. After all, it is important to note that according to state law, religious institutions are exempt from taxes for their first 5 acres of land, while academic institutions are exempt from taxes for their first acre of land. Given that LaSalle occupies 26 acres of land in the Mount Pleasant community through their campus, chapel, and high-end sports facilities, there are 20 acres of land eligible for taxation for the city of Providence. Now, as a result of ongoing budget issues within the city of Providence over recent years, however, city officials, including the mayor and other council members, have actively begun revisiting the conversation about taxing institutions like LaSalle Academy, which is one of the main reasons this bill was first introduced last year and again this year. Therefore, it is clear that a bill like this is a political favor to keep an institution from paying taxes they would legally owe if they were being enforced by the city. This political favor is also something our neighborhood recognizes. Last year, when this bill was first introduced, there was a lot of community opposition, and that has not changed, as over a dozen residents from Mount Pleasant and Elmhurst have submitted written testimony today opposing this bill. After all, property taxes across our city, and particularly in our neighborhood, continue to increase each and every single year due to state and city budget issues, thus putting the tax burden on working people and middle-class families as opposed to wealthy institutions who can afford to pay their fair share, in this case, $98,000. Now more than ever, as we recover from the economic effects COVID has had on our communities, we cannot afford to provide tax exemption statuses to institutions that can and should be paying their fair share. Thank you.
Thank you so much, Representative, for your testimony. We do appreciate it. Are there any questions or comments from members of the committee? All right. Hearing none, Representative, thank you so much for joining us.
Yeah, thank you.
Thank you. Next to testify is going to be the president of LaSalle Academy, Brother Dennis Malloy, in support of the legislation. President Malloy, welcome to Senate Finance.
Thank you very much. Thank you very much. Is this the chairman, Peter Pearson?
Yes, it is, sir. We are ready. We are ready for your testimony.
Okay. Thank you very much for this opportunity. I presume you got the documents that we sent along, and so I'll just go through them very quickly. And just as a little bit of a preface, we've been around for 150 years, since 1871. LaSalle was opened by the Catholic Diocese of Providence on Fountain Street in downtown Providence. And since its beginning, like other educational works for young people, public, secular, or denominational, has not been subject to property taxes by the city of Providence or by the state of Rhode Island. And there are 3 significant acts here that I would like to refer to, and if you have that documentation in front of you, the first is identified as page 1, and it's a document from the General Assembly in 1902, and that document was passed. It was a special act of the legislature that established LaSalle Academy as a Rhode Island nonprofit corporation to maintain an academy of learning. And if you look at section 2 on that document, it indicates that said corporation may buy, devise, or otherwise take hold, transmit, and convey real and personal estate to an amount not exceeding the sum of $200,000. So that was the incorporation. In 1910, and if we look on page 3, in 1910, there was another action by the Assembly that confirmed our property tax exempt status by the Rhode Island legislature, operating as a school for young people. And in section 3 there, in that document, it says said corporation may receive and acquire by gift, devise, bequest, purchase, or otherwise, and may hold, manage, and dispose of real and personal estate and the income thereof to amount not exceeding $500,000, which shall be exempt from taxes. And then there's a proviso there that as long as it stays faithful to its purpose. And the purpose, if we take a quick jump up to Section 2, that said corporation shall be to disseminate complete and liberal education in the arts and science and to afford youth the advantages and opportunities of a liberal education wherein their moral, religious, civic, and intellectual, and so on and so forth, is emphasized. So that's the purpose, and we have continued to be faithful to that. And then on page 5, if you take a look, it's actually 5 and 6. It's another convening of the January session of the Assembly, and it says in 1925, the nonprofit property tax exempt status was confirmed again by special act of legislature when LaSalle moved from downtown, the infamous LaSalle Circle, to 612 Academy Avenue up here where we are now. And if we take a look at page 5, I think we're just going to go to, let me take a look at page 5, and it's in the bottom, it's the last heading there. It says, it is enacted by the General Assembly as follows. Section 1. Section 2 of an act entitled, An Act to Incorporate LaSalle Academy, passed at the January session of 1902 as amended by an act, passed by the January session of 1910, amending said act to incorporate LaSalle Academy and renumbering said section as Section 3 is hereby further amended, so it reads as follows, and this is significant. On the next page, 6, Section 3, such corporation may receive and acquire by gift, device, bequest, purchase, or otherwise, and may hold, manage, and dispose of real and personal estate in an amount not to exceed $3 million. And said property shall be exempt from taxation insofar as the same shall be used exclusively for educational purposes. So my whole point here is just to say we have been tax exempt from the beginning of time. We have never not been tax exempt. And so this is really about confirming our existing status as a nonprofit corporation exempt from property tax. And since the transfer of school property from the Diocese of Providence. And the pending bill does no more than reaffirm LaSalle's exemption from property tax in terms very similar to those adopted many times over the years by the Rhode Island legislature on behalf of many schools and nonprofits of many kinds. And we believe that LaSalle is entitled to equal treatment under the law, to have its property tax exempt status confirmed, just like all of the other schools and nonprofits listed in the Rhode Island General Law Property Subject to Taxation Exemption Statute, and had their property tax exempt status confirmed. So essentially, that is kind of the historical case for our tax exemption, and then I think the last thing I want to share with you, which is, I think it is page 7, just it deals with the community impact by the numbers from Providence. And from Providence, we currently have 208 students, if you kind of read down that page with me. And you see enrollment by city, the next category. We are actually in 35 of the 39 cities and counties in the state of Rhode Island, and Providence is our second largest feeder, if you will, and makes up about 14% of our students. And jumping down to tuition assistance breakdown, let me just kind of read through this with you quickly. In terms of high school enrollment, our high school enrollment is 1,303 students. And we have 175 who are high school students here at LaSalle, and we have, I guess 33 that are middle school students here at LaSalle. And they make up, the high school students make up about 13% of the high school. The next line is more to the point, and it's about financial aid and students that receive financial aid. Altogether, we have about 623 of our high school kids receiving significant financial aid. Our tuition is going to be $16,000 this coming year, and let's see. So we would have 117 of the students from the city of Providence in the high school currently receive a significant amount of that tuition assistance. And you can see again a little further down, about 67% of the kids from Providence in the high school are receiving tuition assistance. And this was an intentional thing starting a couple years ago. We started to recruit more young people from a couple of the charter schools, Achievement First being one of them, also from San Miguel, Sophia Academy, a number of the public schools, and of course, probably the poorest. We identified. I asked the diocese to identify for us the poorest of the Catholic elementary schools, which are basically Blessed Sacrament down the street from us, Bishop McVinney, and St. Thomas, up the hill from us a bit. But one of the things I want to point out as well is the total amount of tuition that is awarded is, about $3.8 million, and $1,260,470 is awarded to young people from Providence. About 27% of all of the students who receive tuition assistance. And while our average award for tuition assistance for schools for children all across the state is $6,198, the Providence youngsters, the average award there is $8,773. And some of our poorest kids, especially kids who are also good students, they pretty much get their whole tuition taken care of. So that's it kind of in a nutshell. And if you have any questions, I'd be happy to answer them.
Thank you so much, President Malloy. We appreciate your testimony, both verbally and also in your written testimony here. I guess and I apologize, I'm just going to maybe brief down some of your points and try to make sure that I have just the accurate facts here. And so I'm going to kind of use a little bit of your written testimony as well as some of your verbal here just to confirm a few things. And I believe your essential argument here is that since 1871, LaSalle has had this property tax exemption. It was reaffirmed by 3 acts of the Assembly in 1902, 1910, and 1925, all related to tax-exempt status. And what you're seeking is a confirmation of your existing status. And your view is that this status that you're seeking is already the status that other schools and nonprofits have, not only in the city of Providence, but statewide. And your point here is that LaSalle is looking for equal treatment compared to these other entities. Is that a fair summation?
It is a very fair summation, Mr. Chairman. The only thing I would correct is in 1871 we were simply established. It was not until the school opened its doors, but it was not until 1905 or 1902 that the school was established as a corporation.
Okay. And could you just, for the committee's sake, talk about what is prompting this specific piece of legislation that you believe that we need to reconfirm the status. Could you just briefly touch upon that?
Well, I think it's simply to confirm what has always been. There's certainly been a lot in social media that we are a wealthy school, that we are avoiding taxes. We've never avoided taxes. We've never been taxed. And it's really just to push back and say, listen, not only are we not a wealthy school, but we are working very hard. I mean, as you can tell from the dollars that we invest in tuition.
Mr. Chairman, we're having trouble hearing the
part of our
testimony.
mission, to make sure young people from working class, working poor, and poor families have a significant place at the table here at LaSalle.
Are there any questions or comments from members of the committee for President Malloy? Senator Felag?
Yeah, I couldn't hear his answer relative to why this legislation is required if that tax exemption had existed for all these years. What prompted this legislation? Because as I look at other tax exempt entities, I see that we put in law for Mount St. Charles, we put in for Providence Country Day, we put in for St. Mary's Bayview Academy, and I'm wondering why all of a sudden now we're putting in for LaSalle. What prompted this action to have this legislation submitted?
I'm having a little difficulty hearing, but if I guess the question is what prompted our bringing forward this proposed act. Is that correct?
That is correct.
Yes.
I mean, what compels us to do this is really we depend on tuition and we depend on donors. We work very hard for the money that we have. We don't receive any money from the city or from the state that could begin to support a school like LaSalle. And we've been very fortunate over the years. And the idea that we would be taxed after all of these years is simply an assault on who we are. And what it does is single us out and treat us differently from every other religious, public, secular, private school in the state. And so again, it's about our receiving equal treatment under the law. I mean, what's good for one, is
Mr. Chairman, maybe you can
to apply to us as well.
I can't hear.
Pardon?
I can't hear your answer, sir.
Listen, I'm sorry.
Let me rephrase the question. Have you been paying taxes on the property? And if so, how many years?
Pardon?
So let me try to, I think there's some audio issues on both sides, so I'll attempt to translate on both sides of that. Senator Felag's question was, have you been paying taxes on the property at all? And if so, how much, I believe, was Senator Felag's question.
We have never paid taxes. We've always been tax exempt.
So I believe the answer from President Malloy, and President, please correct me, was that they have never paid taxes on any piece of this property. Is that correct, President Malloy?
Correct. And that's all documented in the three acts from the General Assembly of 1902, 1910, and 1925.
Are there other questions or comments from members of the committee?
Chairman Pitt.
Senator Chacon.
I did not hear if Providence City Council was in favor or submitted a resolution for or against this.
No, Senator Chacon, we do not have a resolution from the City Council. We do have a letter from Councilwoman Ryan in support, but that is the only communication we have from the Providence City Council.
The last I heard, I didn't think they were in favor. That's why I asked.
Are there any other questions or comments from members of the committee? Okay. Hearing none. President Malloy, thank you so much for joining us in Senate Finance this afternoon.
Thank you very much, Chairman Pearson.
Thank you. Next testify is Jacqueline Goldman, representing herself in opposition. Jacqueline, welcome to Senate Finance.
Thank you so much. Hi, my name is Jacqueline Goldman, and I'm here in opposition. I'm blanking on the bill number, but the one with the tax exemption for LaSalle. So essentially, this is an extraordinarily wealthy institution, and I just heard the person testify before say that this school has never paid taxes, which I see as massively problematic. These taxes could go to a lot of things. The city of Providence and the state are, you look at the governor's budget, you look at the city council budget, constantly looking for places to slash, and often that comes at the backs of, poor working class people. And then you have this wealthy institution that's never been made to pay taxes on their excess land and stuff like that. I think that is a massive disservice to the city and state, and should be opposed, because if, we need to do as much revenue generating as possible. And one way to do that is make wealthy private schools pay their taxes. And also the person who testified before say that, all of those other schools are exempt. That is also not great, and should be addressed. And that's all really I have to say while I'm here. And while I'm on, I would like to say that I do support the Medicaid expansion to women and children, but I'll just leave it at that.
Thank you so much, Jacqueline, for your testimony. Are there any questions or comments from members of the committee? Okay. Hearing none, thank you so much.
Thanks so much.
Next testify is Catherine Goyton, representing LaSalle Academy, in support. Catherine, welcome to Senate Finance.
Thank you.
Please proceed.
Hi, my name is Catherine Guyton, and first and foremost, I just like to share that I am a middle-class working parent, and I have my daughters both have been students at LaSalle Academy over the past 8 years, and LaSalle has played an integral part in helping me finance my daughter's education over those past 8 years. And it would have been a hardship hadn't they assisted us in that way. I do know that LaSalle has also been playing a very proactive role over the past several years with recruiting students of color, whether local or international, from all socioeconomic backgrounds. My daughters both have developed peer relationships with these students, as I've developed also peer relationships with the parents, as they are also working class families, and they have benefited also from LaSalle's tuition assistance. My personal experience has been exceptional. Part of LaSalle's mission statement is to provide a great education for all students. And that's all students based on their economic background. But the most important thing to me was that my daughters would be able to graduate from LaSalle Academy with an exceptional educational experience that was affordable for me and my family in order to help them move forward in society. One of my daughters has graduated from LaSalle in 2013. She has moved on to college, and she's a graduate from college. Hadn't LaSalle provided tuition assistance for me to do that, I probably would be struggling trying to get her through college. I do have a daughter who is actually a senior currently, who is actually also applying to college. LaSalle has played an integral role in offering me tuition assistance to be able to afford the opportunity for her to also move on outside of this institution. I have been a working class family for many, many years, and my main interest was to make sure that both my daughters would receive an exceptional education, and LaSalle has afforded my daughters that opportunity. Anyone who would apply to the school, LaSalle would be there to support them in any way. I do feel like the bill that is looking to label LaSalle as a wealthy institution is very overrated. We have many families who don't make a certain amount of money that would be able to think that they could put their children through LaSalle, but LaSalle has given them hope, and they have applied and they have moved forward, as I have seen these families do so. I do hope that this helps in any way, and it discourages you from labeling or making LaSalle feel as though they're an institution for just the wealthy, because that is untrue, and I disagree.
Thank you so much, Catherine. Are there any questions or comments from members of the committee?
I just want to say, is there, as far as this bill is concerned, were you looking to pass this, and what kind of effect would it have on LaSalle for families moving forward who are interested in applying to the school?
Okay. Are there any questions or comments from members of the committee for Catherine? Okay. Hearing none, Catherine, thank you so much for your testimony.
Okay, thank you. Have a great afternoon.
Thank you. Next testify is going to be John O'Rourke Jr., representing himself in support of the legislation. John, welcome to Senate Finance.
Hi, thank you.
Please proceed.
All right. Good afternoon. My name is John O'Rourke. My wife and I have lived 2 blocks from LaSalle Academy for 27 years, having purchased our home on Jastrom Street in 1994. We raised our 4 children in this neighborhood, and all 4 have now graduated from classical high school. Throughout these 27 years, we have looked at LaSalle Academy as an anchor of our community. While none of our children attended LaSalle, we have had many neighbors and friends whose children have attended LaSalle, and many neighbors who are employed at the school as well. LaSalle provides an important educational option to students from Providence, as well as from the surrounding communities in Rhode Island, saving the city and state hundreds of thousands of dollars in additional costs if these students attended public schools rather than LaSalle. It serves as a critical economic engine in the Elmhurst, Mount Pleasant area, and continually maintains and invests in their property, and it has been responsive to neighborhood concerns. LaSalle Academy has been and continues to be an excellent neighbor. And that's all I have to say.
Thank you so much, John. Are there any questions or comments from members of the committee? Hearing none, thank you so much.
All right, thank you.
Next testify is Kirk Robinson in opposition. Kirk, welcome to Senate Finance.
Hey, how's it going?
Please proceed.
Cool, thanks. My name's Kirk Robinson. I live at 11 Eagle Street in Providence. Thanks for listening to me. I'll be quick. So as I understand it, this bill here would add LaSalle Academy as a list of properties exempt from taxation. Yeah, I mean, I'm absolutely against this. I think that this is just a tad bit absurd, and let me explain why. There's no working class or middle class person in this city that wants this. The only entity that would benefit from something like this would be LaSalle Academy and its constituents. Rhode Island's Providence needs tax dollars to be invested to make the city function better, for things related more towards more affordable housing, better roads, better transportation, maybe some kind of healthcare system that the state could run that would be universal. I don't understand why this is a priority, really, for anyone that doesn't already have a lot. And so, like, I see things like this, and as somebody who wants Rhode Island to be at minimally a functioning social democracy, I see things like this and just think it's absurd. That's it. It's kind of offensive, frankly. That's all for me.
Thank you so much, Kirk. Are there any questions or comments from members of the committee for Kirk? All right, hearing none, thank you so much, Kirk, for your testimony. Our next testify is going to be Enrique Sanchez, representing the BLM Rhode Island PAC and Prov DSA in opposition. Enrique, welcome to Senate Finance.
Hey, how are you doing, sir?
Very well. Please proceed.
Great. My name is Enrique Sanchez. I'm here representing the BLM RI PAC and also Providence Democratic Socialists of America. Before anything, I would like to thank the committee for taking the time to hearing our voices and our testimonies. I am here opposing Senate Bill number 706, this bill that would exempt institutions like LaSalle Academy and other private institutions from, taxes, land taxes, not having to pay taxes across the board. This is a very dangerous and very irresponsible bill being presented before us because I don't know if folks are aware now the current state of affairs in the education field here in Rhode Island. Our public schools are crumbling because of the lack of support and economic funds and resources. And then we have folks presenting bills that would exempt private institutions that don't pay any taxes across the board to be exempt, to be the other option. So, I mean, how can we put this on communities around LaSalle Academy where folks are predominantly working class people, working class folks around that Providence neighborhood? There needs to be a solution so that institutions like LaSalle pay taxes. Let's be honest, folks. The simple sad truth is that we cannot let these neoliberal reforms, these neoliberal projects stay into place because people are struggling. Everyone, top 1%, the leaders need to pay their taxes. And as sad as I can say it, a lot of those parents of those students that go to LaSalle Academy, belong to that upper middle class, top 1%. So at the end of the day, if the working class and the poor people are going to suffer economically, then everyone has to suffer economically at the end of the day because we're in the middle of a pandemic. People are struggling. Unemployment's high. We need everyone to pay their fair share of taxes, and we need the top 1% to pay their fair share of taxes. And thank you very much.
Thank you so much, Enrique, for your testimony. We do appreciate it.
Thank you.
Next testify is Erin Papa, representing herself, also in opposition. Erin, welcome to Senate Finance.
Hi, Chairman Pearson and members of the committee. My name is Erin Papa. I am a resident of Providence, and I live in Senate District 5. I'm calling in opposition to Senate Bill 706. We actually had many community meetings on this last year, and I'm really disappointed to see the bill coming up again. I think as a lot of the other speakers have touched upon, Providence is really in need of support from the state, and exempting private institutions is really not helping us to support our public schools that are in need of funding, and all of the other city services that have been neglected by the state for so many years. There was clear community opposition to it, and I know that there have been some callers saying that LaSalle's been a great neighbor and that they've provided tuition support to some children, but this is taking money away from our public schools and public services, and I think that introducing a bill like this is problematic, and I hope that you will all decide to oppose the bill. Thank you.
Thank you so much for your testimony. Are there any questions or comments from members of the committee? Hearing none. Thank you so much, Erin, for your testimony. I do appreciate it.
Thank you.
Next testify is Andrew Poya, representing himself, also in opposition. Andrew, welcome to Senate Finance.
Hi, Chairman Pearson. My name is Andrew Poya, and I oppose Bill 706. I am a Providence resident in Senate President Ruggiero's district and in the neighborhood of LaSalle. I don't think that we should be giving special tax exemptions to private schools. Our public schools and other infrastructure need tax revenue in order to be improved, and I don't think that we should be allowing them to have a special exemption. Thank you.
Thank you so much, Andrew, for your testimony. Are there any questions or comments? Hearing none, thank you so much. Next to testify is Aline. I apologize, I will likely mess up this name, but I believe it's Aline Binyagu, representing as a parent of LaSalle students in support of the legislation. Aline, welcome to Senate Finance, and I hope I did not butcher your name too badly.
No, sir. Yeah, so can I speak?
Please proceed.
Yeah, so my name is Aline Binyungu. I am a parent of 3 students from LaSalle. Yeah, so I'm so proud to be a mother of the LaSallians. LaSalle is a good school, a Catholic school, with a Christian education, the best education. Yeah, I live in like a refugee and immigrant community. I'm very proud of my children because they are very focused. They are always home after school. Anytime they are absent, just 20 minutes, I get a phone call. Yeah, so I will ask you please to sign that bill for the tax exemption for LaSalle, tax property, because I'm a very low-income family. We can't afford the tuition, and LaSalle is helping me, and I am not alone. Yeah, so the education is the best gift we can give to our children. So please sign this bill and help our children to build Rhode Island, to be proud to be in the U.S. Yeah.
Thank you so much, Aline, for your testimony. Are there any questions or comments from members of the committee? All right. Hearing none, thank you so much.
Thank you, sir.
Next to testify is Tom Wayman, representing himself in opposition. Tom, welcome to Senate Finance.
Hi, thank you. My name is Tom Wayman. I live on Enfield Avenue, about 5 blocks from LaSalle Academy in Senator Ruggiero's district. I'm calling today to oppose Senate Bill 706 because I don't believe that LaSalle should receive any special treatment just because they are a nonprofit or a religious institution. I have friends that work at LaSalle and friends that send their kids to LaSalle, and I do appreciate the value that they bring to the neighborhood and the education that they provide, but I still think they should pay what they owe. Furthermore, I don't appreciate that LaSalle has appealed directly to legislators without making their case to the people of Rhode Island. If they claim they can't afford to pay taxes, I'd like to see their financial statements that prove it. They're not required to share financial statements as a religious institution. It appears that they have millions of dollars in endowments and plenty of wealthy parents and graduates who donate to them every year. Every institution, religious or not, for-profit or non-profit, should pay what they owe, and I see no reason to make an exception for LaSalle. Thank you.
Thank you so much, Tom, for your testimony. Are there any questions or comments for Tom? Okay. Hearing none, next testify is going to be Nellie Goodlin, representing himself in opposition. Nellie, welcome to Senate Finance.
Thank you.
Please proceed.
Thank you.
Are you prepared to testify?
Yes, I am.
Okay. Please proceed with your testimony.
My name is Nellie Goodman. I'm a resident of Mount Pleasant. My address is 66 Charles Street, and I have lived here for 26 years. I am opposed to Section 706, which is the tax break for LaSalle Academy. First of all, I make $13,000 a year, and I pay $676 a quarter for taxes. Why should LaSalle Academy get a tax-free break when I am working and paying taxes? What has LaSalle done for our environment and our district? LaSalle has not done a thing for our district. My daughter attended LaSalle Academy. She's a graduate of LaSalle Academy. I worked for the state for over 30 years. And each month, for her monthly payment, if I was to make her payment on Friday and I was getting paid on Friday, LaSalle would put her in the library until I received my check from the state that Friday and go to the school to make her payment. LaSalle has not helped enough us in this area. LaSalle received free books from the student or the state. Why should they get more break? I'd like for someone to explain that to me. I am very much opposed of them having a tax-free break. I have not heard anything during our meeting, our monthly meeting, about LaSalle helping District 5. No, nothing. We have a water building, the water building on Academy Avenue. That building should be used for low-income parents for daycare. LaSalle has been after that building and its parking lot. Why should they get that building and get tax-free with parents going to work at 6 o'clock in the morning, having their babies standing at the bus terminal all by themselves waiting to take a bus, a 5, 6-year-old, 7-year-old. That building could also be used for daycare at a reasonable amount to help working parents. And we have asked the city to help us on Mount Pleasant area with speed bumps. We have been turned down because the city is short of money. But Academy Avenue and Smith Street have always been renovated for LaSalle Academy. So once they receive a break on taxes, this is what I'm asking my representatives to explain to me why. I am very much opposed to what they are asking for. Thank you.
Thank you so much, Nellie, for your testimony this afternoon. Are there any questions or comments for Nellie? Thank you so much. That does conclude our testimony on Senate Bill 706. Senator Palmer?
Mr. Chairman, I move passage.
Senator Palmer makes a motion to pass. Second by President Ruggiero. The clerk, please call the roll.
Chairman Pearson.
Yes.
Senator DePalma.
Yes.
Senator Felag.
Yes.
Senator Acosta. Senator Acosta. Senator Cano. Senator Cano. Senator Chacon.
No.
Senator Murray.
Yes.
Senator Sebeny.
No.
Senator Sosnowski.
Yes.
President Ruggiero.
Yes.
6 in favor, 2 opposed.
It appears that I may have said a lot of things on mute, so I will repeat myself. I apologize for that. Oh, all right, I got it. So I apologize for that. I said a lot of things on mute. We'll be transferring over to our next section of our hearing this afternoon related to the budget, Article 6, Section 5, hospital license fee, Article 12, medical assistance, Article 14, hospital uncompensated care, Article 15, Sections 9 through 10 on Rite Share. Director Romer is here on behalf of the administration to begin the presentation on these items to the committee. Director Romer is also joined by several individuals from the Executive Office of Health and Human Services. And Director Romer, I will turn over to you to begin and also introduce the other colleagues that are joining us from the administration as appropriate.
Thank you, Chairman. Members of the committee, good to be here today. I have with me Anna Weiss, Assistant Secretary from EOHHS, Ben Schaefer, our Director of Medicaid, and Brenda Whalen Monroe, Financial Management Administrator at EOHHS. If it's okay, I'd like to turn it over to Anna Weiss, and she and Director Schaefer are going to go through a brief PowerPoint presentation for you.
Yes, thank you. Can you hear me well?
Yes, we can.
Okay. So good afternoon. Thank you, Chairman Pearse and members of the committee. It's good to see you all again, since I see you quite a few times this year. As Jonathan said, I am Anna Weiss. I'm the Assistant Secretary of the Executive Office of Health and Human Services. I bring you greetings from Secretary Jones, who is currently traveling and unable to make it here tonight. Medicaid Program Director Ben Schaefer and I will walk through our presentation today, and we welcome any questions you may have. As you know, the Executive Office of Health and Human Services coordinates and supports the delivery of programs and services across Rhode Island's Health and Human Services Agency and divisions. It includes the DCYF, the Department of Health, BHDDH, DHS, the Office of Healthy Aging, and the Office of Veterans Affairs, and our program, Medicaid. I want to briefly mention some of the most important pieces of the Governor's State Fiscal Year 22 budget as it relates to EOHHS. That involve long-term services and supports, community health workers, the doula services, as they tie directly with our EOHHS guiding principles of providing clients with choice in the services they receive, using a race equity lens, and ensuring that the community is engaged at the beginning and throughout our work. Governor McKee's budget recommends investments to promote a vision for the long-term services and supports LTSS system that will foster a more sustainable and responsive continuum of long-term care services. The goal is to provide services that deliver the right support at the right time and at the right cost, while promoting choice, community, and quality of life for Rhode Island elders and the disabled. Director Benjamin Sheffer will be talking about the community health worker services as a Medicaid benefit, as well as the doula services, and I will leave that for him to go in more detail as he does the presentation. What I would like to stress is that at the end, April is Minority Health Month, and we must once again urge passage of all of our initiatives that are reiterating and that are improving all of the inequities that we've seen in the health services, addressing the inequalities that more profoundly impact our communities of color. We are so grateful for your continued advocacy and leadership on behalf of all of the Rhode Islanders. With your support, we are building a healthier state, nurturing people's quality of life, and helping residents meet their basic needs. As we face challenges moving forward, it's important that we continue to work together to balance Rhode Islanders' critical health needs, particularly as our state begins recovering from the pandemic. Our presentation today, along with Director Schaefer, if you could move for the first slide, we want to review with you our priorities and then go through some specific initiatives that we'd like to highlight for our budget. Next. So as you can see, we discussed during my brief introduction, the budget that we're going to be proposing, that we're going to bring in front of you, is focusing on not only maintaining and sustaining our public health emergency, response to our public health emergency, but it's laying the foundation to assure that Rhode Island recovers from the pandemic stronger and healthier and more resilient than ever. It continues to focus on EOHHS priorities of access, including quality and cost, to preserve the access to quality, cost-effective healthcare, continues to focus on health systems transformation, making sure that our investments shift to prevention, value, choice, and equity, and not just focusing on treatment. Addressing behavioral health needs. We know the impact that the opioid epidemic has had in the past years and how much it has also compounded now during the COVID past year that we have. So we need to address the opioid epidemic. We need to address addiction in general and the codependencies that we see in so many of those issues. And we need to improve mental health in general. We also want to make sure that the care, the services that we provide, the operations that we have are effective and efficient, and most importantly, are fair. And we need to focus our investments moving from just the COVID response, which continues to be important, addressing today's needs, but starting to focus on tomorrow's recovery from the pandemic. So next, please. I would like to highlight, next one, Ben, some of the budget initiatives from our EOHHS agency. First, one that I would like to highlight, it's an investment on the analytics. We are requesting an additional funding for existing, that we have today, core functionality at EOHHS that is related with our data ecosystem that includes a variety of data from across our state agencies, as well as the all-player claims database. This is to account for loss in federal funding. That budget includes $600K in state match to support our analytics. Without the additional funding to offset the losses in federal match, EOHHS will be unable to continue to provide the analytic support at EOHHS as all of the other agencies, which includes also the performance management activities that we have, public reporting on cross-agency data, and assisting with the development of many other budget initiatives and proposals. So this is an important investment for us as it supports a core infrastructure for EOHHS. Next. We also have a few items that are focused on health information technology initiatives, our HIT. This governor budget provides approximately 1.1 million from all funding sources for HIT-related initiatives. Some of the components of their investments are outlined below, which also include some funding from our opioid stewardship fund. We are requiring an investment in the current care that provides these initiatives specifically is providing additional funds for the state's health information exchange, again, kind of given a reduction in state federal match. We are also asking for resources for the additional funds for the quality reporting system that allows for increased availability of outcome data, and this also supports our healthcare transformation efforts. This is again needed to account for a reduction in federal match for this project. Our prescription drug monitoring program, it's another investment that we are allocating funds to support the electronic health record systems to help with our opioid pandemic. And then we are not requesting, we are going to be recommending applying for information service technology funds to support a series of roadmap projects that will be determined based on public and private input and through the steering committee. Next. These are some of the staffing resources that we are also that's also being recommended. This budget, the governor's budget recommends. The governor's budget recommendation also recognizes the need to make some adjustments in terms of staffing and resources that we have. And most of those are in fact part of what my colleague, Director Ben Schaffer, will be talking with you because most of them exist within the Medicaid program. I will only highlight some of them is assuring that EOHHS wide legal positions continue to be centralized at the department. And so we are shifting 2 FTEs into our EOHHS FTE cap and budget. Those are positions that are right now in other departments. So Ben, I will pass it on to you.
Thank you very much, Anna, and members of the committee. Thank you for having us here today. Hopefully you can hear me okay. As Anna mentioned, I will touch briefly on these staffing items that are particular to the Medicaid program, and then in the next section go on into a bit greater detail on hospitals, our LTSS investments, and our community investments within the Medicaid budget. There are a number of staffing changes and resource requests designed both to make EOHHS and Medicaid run more smoothly and to invest in our people and the policy implementation that is recommended in the governor's budget. First and foremost, we're recommending transferring the Office of Medical Review from EOHHS to DHS. This would be 10 full FTEs. This is not due to a cost-cutting or cost reduction measure, but simply a proposed reorganization to ensure that everyone who actually processes long-term care applications sits within the Department of Human Services. We believe this will make management of those applications and those application processes easier, and more streamlined, particularly coming out of the public health emergency where we know individuals are in need of long-term care. Tied to 2 of our Medicaid budget initiatives in the third bullet are requested increases in FTE cap and funding for 2 positions to support long-term services and support within the executive office, and 1 additional program integrity FTE
aligned against the various savings initiatives included in long-term care and in program integrity. Similarly, the last bullet for the SaaS or software as a service vendor for third-party liability is essential management investment tied to the implementation of that budget initiative, which is designed to ensure through better data and better data management that Medicaid serves as a payer of last resort. So while an individual may be on Medicaid, if they have some other form of insurance, that insurance is billed first, and then Medicaid and therefore the state is billed last. And finally, we are also proposing to move the Medicaid expenditure report, which is an annual report that we do to provide the General Assembly and others information about Medicaid spending, to move that report in-house and delay the timing of that report, moving it sort of 3 months from its current due date to result in $138,000 in savings. Finally, though it's not on the slide and it's not a specific staffing resource, it's in the central management budget. Also included in the governor's recommended budget is a $279,000 general revenue reduction for RIPEN, or the Rhode Island Parent Information Network. RIPEN currently provides ongoing care management to fee-for-service clients on long-term services and supports. They also have provided LTSS renewal outreach and to assist members in completing LTSS renewals. This budget initiative is included in the governor's recommend, but was originally developed under more significant cost savings proposals. And this item we are hoping and was flagged for potential reconsideration should additional federal funding become available and if the budget picture improves. So I wanted to make mention of that before I head into, in particular, our long-term services and support section. As Anna mentioned, I'll shift gears to talk more about a couple of specific initiatives that are primarily in the Medicaid budget and that we believe will help invest in our Medicaid system. First, I want to highlight the initiatives focused on hospitals. There are several initiatives that are proposed impacting hospitals, including the elimination of UPL for outpatient services, the elimination of the GME or graduate medical education payment, and a restoration of the 6% hospital licensing fee in both fiscal year 21 and fiscal year 22. You can see the savings, both in general revenue and all funds listed here. In particular, the reinstitution of the hospital licensing fee is a significant amount of revenue for the state. The licensing fee was recently at 6%, at the 6% level. This, while being flagged as another potential item that could be reversed depending on federal funding and the announcement of the governor's recommended budget, inclusion here is a recognition in the significant amount of funding that hospitals receive and continue to receive through the Medicaid program, as well as through other federal and state investments throughout the pandemic, both directly at the federal level to reimburse for COVID costs, as well as state-specific programs like the Hospital Assistance Partnership Program that put hundreds of millions of dollars into our hospital system. Again, we understand that this was a item that was flagged for potential reconsideration depending on additional federal funding. However, we still await clearer guidance from the U.S. Treasury Department as to whether or not and how those funds can be used, necessitating the inclusion of this item so that we can balance the budget in an equitable way as possible. Shifting gears of a number of slides on the governor's recommended budget related to LTSS resiliency and rebalancing. This is a significant focus in the governor's recommended budget, particularly coming out of the public health emergency, where we know that our long-term care providers and members were significantly impacted. Assistant Secretary Novice covered a number of these topics, but whenever we talk about long-term service and support, we like to ground ourselves in a vision, and that vision is that any Rhode Islander can receive the right support at the right time, at the right cost of services. And in particular, we focus on access to these services, choice in these services, sustainability in these services, and that these services be provided in a quality manner for all Rhode Islanders. A strong LTSS system requires many components working together. This includes a robust workforce, quality nursing home, assisted living, and home care agency providers, person-centered care management, self-directed options, and options counseling for Rhode Islanders to be able to understand their options as they age and as their needs change. It also requires a shift in spending towards home and community-based services. Rhode Island has a significant opportunity to rebalance Medicaid LTSS utilization away from these institutional settings and towards home and community-based services. This is actually enshrined in Rhode Island general law and supported both by federal HHS and by CMS. And the slide you have before you is meant to sort of set the stage and provide context for where we are in this journey. Rhode Island currently spends about 24% of its spending on home and community-based services as compared to the national average of 45% and significantly less than other more rebalanced states. So these budget initiatives that I'm about to walk through really are designed to start to shift and continue to shift our spending towards home and community-based services. As part of these budget initiatives, we also took a very deep and data-driven look at our goals and barriers across the continuum of care. As I said, we believe that all provider groups, all types, from nursing facilities to assisted living to home settings, including home care, shared living, personal choice, independent providers, and other self-directed programs are all part of this continuum. So I won't review the entirety I won't read this entire thing to you, but will point out a couple of items as they're designed to really focus our attention. In particular, when we were looking at the data and constructing these initiatives, we focused a lot on assisted living, and that was simply because Rhode Island, particularly for Medicaid, is significantly underutilized for assisted living, and we have limited provider participation, especially compared to national benchmarks. So if we are serious about improving our LTSS system in a rebalanced way, we need to look at best practices for how we pay assisted living facilities and to understand and make sure that they will participate more fully in the Medicaid program. Similarly, if we want to increase the availability of home settings, particularly for home care and shared living, we need to address workforce shortages and address the difficult time Rhode Island families can have filling all authorized hours. And in particular, as we work with colleagues and look at the data, this is particularly acute for off hours, so for nights and weekend coverage, as well as for patients or Rhode Islanders with more acute needs, particularly behavioral health needs. It's our hope as we looked at these barriers to design policies that were specifically targeted to address them, as well as continue many of the investments that we made during the public health emergency using about $20 million in CARES Act funding. So without further ado, I'll walk briefly through the initiatives that are included in this package. I mentioned targeted home care rate increases. These are taking two main forms. One, we're proposing increasing the shift differential modifier, which is essentially a 15-minute increment that is paid to home health agencies depending on the shift that is worked to promote home care access on nights and weekends. So we'd be increasing that amount in order to provide greater incentives for home care workers and home care agencies to take those hours. Similarly, we'd be creating a new behavioral health rate enhancement for home health agencies that have 30% of their CNAs behavioral health certified. We piloted this program a number of months ago using CARES Act investments and trained about 72 CNAs and workers in behavioral health. And we want to continue to incentivize that work. And I should mention that this is on top of existing statutory COLA increases. We are proposing shared living stipend rate increases. Our shared living rates have not been increased in quite some time. We want to keep those rates as competitive as we can with other home care options. I should mention shared living is an option whereby an individual actually cares for someone in their own home and receives funding from the state to do so. And finally, within this home setting bucket, we are proposing to increase the home and community-based services maintenance of needs allowance from a little bit over $1,000 a month to 300% of the SSI standard, which is about a little bit less than $2,400 a month. This is targeted, importantly, at allowing more Rhode Islanders to keep more of their funding, more of their own money to allow them to stay in the community, even as they access Medicaid benefits. Right now, if you're on Medicaid, that $1,083 that you see on the slide is the amount that you are left to pay for rent, utilities, groceries, what have you, and it simply has not kept pace with those kinds, with that investments and those expenses that individuals staying in the community will have and need. So we believe it is time to raise that allowance now to allow more Rhode Islanders to stay in their cities and towns where many want to be rather than in a facility. Next, I mentioned assisted living and the underpenetration in assisted living and Medicaid that we have. We propose changing the way that we pay for assisted living to encourage its growth in our state. Rhode Island is currently one of only 6 states that does not pay assisted living residents based on acuity, but rather pays a flat fee. As a result, just 15% of assisted living residents are on Medicaid, compared with 25% in most other states. Our new payment model would both raise daily reimbursement rates and enhance rates based on resident acuity so that assisted living providers can be properly paid for the quality of care that they provide. And I should mention that we also hope that by eliminating this SSP Category F, we will both reinvest that general revenue into the Medicaid assisted living rates to capture more federal funding and significantly simplify the administrative burden that both assisted living residences and the state currently have. Finally, because the continuum of care is so important and because we know that investments in behavioral health are important, we are proposing increasing RUG rates, which is the way in which nursing facilities are reimbursed based on the acuity of the patient in their care or the resident in their care, increasing those rates specific to behavioral symptoms and cognitive performance to support higher quality of care. We would rebalance other RUG weights to keep that amount budget neutral for the state, but for nursing facilities to take on a higher percentage or higher amount of residents with behavioral symptoms or cognitive performance declines would see increases of about 10% in their per diem rates. Now, as you mentioned on the previous slide, we are also asking for 2 FTEs as well as some system changes to support all of the above. Incentives in investments in our LTSS system do require individuals to make sure that they occur properly, to work with providers and others on implementing them, and to monitor that implementation and ensure quality. Finally, I'll shift focus a bit from our long-term service and support system to a suite of initiatives that I think highlight the kinds of smart investments we can make in the Medicaid program in our communities. As a number of individuals testifying before me and Assistant Secretary Novice mentioned, we have seen in the most difficult of ways over the last year how systemic underinvestment in our communities and in one part of our state really will impact the entire state. And to build a more inclusive healthcare system, Governor Rickey recommends adding community health workers and perinatal doula services as Medicaid benefits, and he also proposes expanding family home visiting and first connections. Community health workers, which are presented here on this slide, will help Medicaid beneficiaries to address their social determinants of health. As you may know, up to 80% of a person's health outcomes are determined by social and economic factors like housing, food insecurity, personal safety, and income. Collectively, again, those are referred to as the social determinants of health. Community health workers are trusted individuals from the communities they serve that provide social support, care coordination, and advocacy for high-risk individuals. There's also mounting evidence showing the clinical benefits of these interventions, and studies have demonstrated improvement in these clinical outcomes, including chronic disease control, mental health, quality of care, and reduced hospital utilization. These studies are so strong that they say that for every dollar invested in community health workers, we could save almost $2.50. Because of this research demonstrating this positive ROI, we actually estimate net savings for this initiative despite adding it as a Medicaid-covered benefit. Next, family home visiting and First Connections. These are programs that are operated through our Department of Health and extremely, as well supported by evidence. We will be proposing to add funding to the Medicaid budget to make to expand these programs, which aid mothers and young children. Adding this funding to the Medicaid budget would allow expansion and taking advantage of additional federal support. And we would expect to be able to serve approximately an additional 60 families with this Medicaid match. This is, again, sort of significantly targeted at mothers with young children, which is in particular an area where we see not just significant coverage on the Medicaid side. Medicaid covers about half the kids in the state, but also significant impacts on the public health emergency, childhood vaccinations, lead screenings, screenings to early intervention, all have declined as a result of the public health emergency, and investments in this area, particularly now, can help arrest that decline. Last, but certainly not least, we again recommend covering perinatal doula services and adding that as a Medicaid benefit at an anticipated cost of just $100,000. This item could clearly be overlooked. It quite frankly shouldn't be. Studies show that doula care reduces the likelihood of costly and often unnecessary interventions, such as cesarean birth and epidural pain relief, while increasing the likelihood of a shorter labor and positive childbirth experience. Low-income women are at the highest risk of poor birth outcomes in the United States, especially women of color. Unfortunately, this holds true in Rhode Island, where infant mortality among Black women is almost 4 times what it is for white women. Doula care is considered among the most promising approaches to combating these disparities. And in particular, we know that this is an area in which patient empowerment and mother empowerment in the hospital and throughout the birthing process is important, and where we know that doulas are able to help mothers who need it and mothers who may otherwise not feel that they can speak up for themselves within the healthcare system. I'll close by saying under Governor McKee's FY22 budget, Rhode Island will continue to maintain all Medicaid benefits while reducing costs, promoting access, improving quality, and driving innovation. Medicaid enrollment in our state is the highest it has ever been, with almost 329,000 of us in every city and town receiving Medicaid coverage. As we face these challenges moving forward, it's important that we continue to balance Rhode Islanders' critical health needs, particularly those resulting from the pandemic, while also being good stewards of the taxpayers' dollars. We join you in a commitment to do this moving forward. Thank you for the opportunity, and Assistant Secretary Novice and I are happy to take any questions you may have.